Started here, I just want to go ahead and again welcome Mary and Eric from Allstate. I think a lot of you have had some contact with them and listened to their information, but we thought it important with some of the new regulations coming out about the short-term medical plans that are being presented in the next couple of months, that it would be good for agents to be aware of those. So as they're quoting, getting under some deadlines there, we can go ahead and have those available. So I'll turn the time over to Eric and Mary.
Thanks very much, Dave. We appreciate the time. Good morning, everybody. We always appreciate all the support you give us, and we're happy to kind of talk about this executive order. Well, not happy about it, but we're happy that you've all joined us so we can go over what this executive order means to you and your business and what we're doing as a company to help you get ahead of it, to make the most of the selling opportunity that we have this summer. So I've got Mary Steele with me. I'm sure most of you know her and me as well. So we're just going to take 45 minutes to go through the plans here and what we're planning to do with it. Give me just a moment here. I'm going to pull up my slide deck.
Hi, everyone. We'll put our contact information up here, so be sure to reach out if you have any questions, whether it's specific applications or how to do anything. I'm always happy to help.
Can everybody see my screen now, the big slideshow?
Yes.
Yes.
Okay. So there's a link on your screen here that I'd like to call out. It's a agent resource page. We build these for specific agencies as a way of getting quick answers to commonly asked questions. So it's basically the Stonehill FAQ page for anything Allstate Health individual related. So if you click on that link, it's just http://stonehill.contractnow.us. And when you open that up, you're going to find links to our current bonuses, to live webinar trainings that we are going to be doing throughout the next month and a half. A lot of that we'll cover on this call, of course. And then just links to the product pages, whether it's supplemental, Medicare, our fixed indemnity, under 65 product, short-term medical, and links to on-demand training. So if you want to take a deeper dive into any of these products, we have a YouTube page, and there's a link directly to that from your agent resource page and other things. And our contact information, of course, is there as well. So please check that out and bookmark it. I think you'll find it very helpful. We've also got a rewards program that we launched earlier in the year. Many of you have registered for the terms or accepted the terms and conditions of this. Essentially, it's a rewards program similar to what you'd have on a credit card. So you get paid extra points just for writing business with Allstate Health, and you can accumulate points total and redeem those for gift cards and other goodies like that. So there is an app. You can scan the QR codes on this screen here anytime just to download the app, and you can, of course, navigate that way. You can also access it through your agent back office. So I want to call that out as well. Let us know if you need help doing that. But this is your sales team in general. Mary and I are your contacts for anything under 65. Rory Gregg is our senior counterpart. So anything med sup, final expense. We have a new final expense life product that launched in Utah just last month. So he'd be your contact for anything related to senior products on a daily service basis. So I'll get right into it here. So the short-term medical regulation that was proposed last July has now been finalized and will take effect the 1st of September. So what that means is we have business as usual until September 1st, but I want to go through the language so you understand exactly what is going to change and how it's going to affect your opportunity for selling short-term medical going forward after this date. So the final ruling reads that beginning September 1st, 2024, short-term contracts are going to be limited to no more than 3-month max durations, with a coverage max no more than 4, including any renewals or extensions. So for those of you that wrote short-term medical back in 2016, it's very similar to the limitation that was imposed as an executive order by the Obama administration, with the exception of a couple of things, which I'll highlight on the next screen. But essentially, you've got a 90-day plan you can offer as a max duration with an opportunity for a 1-month extension. So really think of it as a 4-month short-term medical plan is going to be the maximum duration you'll be able to sell as soon as September hits. So it's a pretty big change to what we have here. And the other caveat is that the policies STM policies will not be able to be sold or renewed by the same issuer or any issuer that is a member of the same controlled group to the same policyholder within a rolling 12-month period, which means we're not going to be able to do stacked plans. A lot of you may remember the 3x4s or the 6x2s where we could sell On the 3x4, we'd sell a 3-month plan 4 times with one application, covering a total of 12 months. This particular line in the final order prohibits us from doing that. So we're not going to be able to stack plans to give you a 12-month solution like we have in the past. Instead, you're going to be only able to offer a 4-month solution, and then your client would have to buy a short-term plan from another provider or go without insurance or buy some other type of insurance product until the 12-month period comes back around again. So this is a very big change, and because of this particular clause, it's going to leave a lot of your customers who buy short-term medical plans early in the year potentially exposed to medical changes in their medical history and their health. So all short-term medical plans in Utah have to pass an underwriting piece. So there are some medical questions. They're pass-fail underwriting. So you'd have to answer those questions correctly in order to be even eligible. So it is entirely possible a customer buys a plan, something happens within those first 4 months, and then they're not eligible for another type of short-term plan because of a change in their health. So that is a very important thing to keep in mind. There's not really going to be a 12-month solution after 9/1, but the silver lining here is that until 8/31, so the end of August of this year, you can continue to sell the existing short-term medical durations as they are available on the shelf today, which means you can sell up to 3 years. We have 3-year durations, 3 complete years available with one application. So our recommendation, of course, is to use this opportunity right now as a selling season, because we are allowing you to write January 1st effective dates as of now. If you run a quote in our system, you'll be able to get pricing rates for January 1st, 2025 effective dates. So just because that 8/31 deadline for us, the way our lawyers interpret this, is a submission deadline, not an effective date deadline. So we are giving you the option to extend the runway for any of your business. Let's say you wrote somebody last year in the 4th quarter with a January 1st effective date, and you wrote them a 3-year plan. You could write another 3-year plan for that same person effective January 1st, 2025, and essentially extend the runway out another year. And this would be ideal for your customers that are good candidates for short term. Obviously, people with health conditions and chronic diseases and ongoing treatment would not want to buy another short-term plan unless they're comfortable with the 12-month pre-existing exclusion. So our pre-X exclusion period is 12 months. So if you sold a 3-year plan, only the first year would be subject to pre-X. But again, you want to check your client's health, make sure they're not getting regular treatment, because anytime you do a new application, that pre-existing condition look back starts over again. I'm going to pause here for a second. I'm not able to see any of the questions with the way my view is here, so I'm relying on you.
I'll keep an eye on it, Eric.
Yeah, go ahead, Mary. Is there anything you want to add to that, Mary? I don't want to rush past this because this is a pretty important thing.
Yeah, I don't either. And then what Eric's talking about is, for those of you who've written with us before, we have this rewrite process. So when you check the rewrite box in the application, if you're doing an app for your member, or if they're enrolling themselves, there's a little question there saying, if this is a rewrite, check here. If they check that box, we look for that prior plan, and we'll term it the day prior to the new plan. So like Eric mentioned, if you want to write a piece of business that's already on the books with us, but you want to rewrite it for 1/1 of 25, they qualify. You choose that 1/1/25 effective date, check the rewrite box, and we would term that prior plan on 12/31 of 24. Now they've extended that runway as far out as 3 years if they did a 3-year plan on 1/1/25. So hopefully it makes a little bit more sense with the whole rewrite process that we do.
Yeah, a lot of our customers who buy short term buy it for years and years and years. It works for them. They continue to buy it. They like the network. They like the features, the bells and whistles on the plan. They like the PPO network. They like that their kids can go to college in other states and stay on the parents' plan because it's domiciled in Utah. We have a national network with both of our options. I'll go over this in a moment, but we have really big networks with centers of excellence all across the country. So it's a great solution for people with families where maybe some of the children are going to school in another state. Maybe some people have 2 homes. They spend summers in other states. Maybe they're in California for part of the year where we don't sell short-term, but you can still sell it in Utah and your customers can use it nationwide. That's something that we allow with this product. So there are a lot of people that like it for those reasons. And a lot of them are going to want to keep it as long as possible. So the runway is important to people that really like this product. So that's how you do it. All you would do is simply, we make it pretty easy for you. You just write the piece of business you want, pick the effective date, and any of the existing coverages, we manually, or under the hood, we do it for you. We just terminate it so there's no gap in coverage. And we do a prorated refund on any overpayment right back to your customer.
And let me add something else, Eric. And you said it, but I just want to say it another way so people understand. When you rewrite these policies, the rewrites have a new pre-ex and new qualification. I hear a lot of agents saying, well, they've had a policy for years. Yes, that's great. You know, we love the business, but when you rewrite a policy, it is a brand new qualification and a brand new pre-ex. So please make sure your client that you're going to rewrite does qualify and doesn't have a pre-ex that would be affected by this. And I'm getting a question about the network. We're going to get into the networks. We do have 2 networks. We have the Aetna and Cigna network, but as Eric goes through the presentation, we're going to talk a little bit about the networks at that time. So we'll address that in just a few minutes.
Yeah, we urge you to look at your existing book of short-term clients and make sure that everybody that is in your book of business has the enough coverage for them. You know, if someone's going to expire in 2024 and they are good candidates, we recommend really rewriting them now with the longest duration that you're able to write. In Utah, our rates are very low, certainly by comparison in other states. So it's an attractive option. We have a lot of agents that write lots of short-term business in Utah. But getting it on the books before 9/1 is incredibly important, because as soon as 9/1 comes, we won't have any real solution for them that's going to be a permanent or a longer duration type option. So getting it in and signed before that date is really critical. So this is really the early open enrollment for short-term medical. This is something that if you want to do it, you have to do it before the end of August. And if something happens with their health or they change their mind, they can always drop the plan. There's no requirement for them to keep it for 3 years. The only requirement is that we have to make it available to them for 3 years. So the obligation is on us as the company, not for the customer. So here are a couple of...
Hold on one moment, because I
Sure.
had a comment in the chat about I missed the 3-year max short terms. So because of that, you can write those now. So if you have somebody who wants a 3-year plan, you can do that as long as the app gets signed. This is what we're talking about. You can do that now as long as you get the app signed prior to 9/1. You can write a 3-year plan. You can start it as soon as tomorrow, or you can go out 180 days with that effective date. So this is our window. As long as it's signed prior to 9/1, you can write a 3-year plan, and it is grandfathered.
So we have long durations, as we mentioned. 2- and 3-year options are still available until the end of August. And we also give you the option to sell it with a locked premium or a rate guarantee. This is something that doesn't exist really with any other health insurance product out there. No ACA plans or group plans offer you rate guarantees like this. So you do have a unique opportunity to pick a premium and say, this is exactly what my customer will pay for 36 months in a row. And no matter what happens to medical inflation, no matter what happens to availability of products out there, this is a locked, contractually signed deal. But it has to be submitted and signed before 8/31. And a note on commissions. A lot of you may have written our 12x2 plans in the past, or have written our short-term plans. We used to pay a higher first-year commission on the renewable short-term plans with a lower renewal second and third year, but we've changed that. That changed back in October. So if you write a 3-year plan, you're going to be locking in level commissions for the entire duration for yourself. There's no more heaped higher first or lower second and third year renewal commissions. It's going to be level, basically first year all the way through. So it's a big advantage to you. It's a nice way to lock in build yourself a 3-year annuity while all this change is occurring. And likelihood of it being persistent business, I would think, is going to be very high, because most people aren't going to let go of a 3-year short-term plan in favor of a 4-month short-term plan, which is all that's going to be out there after September 1st. So there is a good opportunity, good possibility that will be persistent business.
And keep in mind, though, like Eric mentioned, they can terminate at any time. They're just locking in with us, you know, so they're guaranteeing they would have this plan, but if they need to cancel this plan at any time, they can.
We've also got a bonus program that we launched in May. It runs through the end of August. And this is going to be, this will be applicable to any multi-year sale that you make with us. We're going to show you the flyer at the end of this here. But we do have a bonus plan running now through the end of August to help incentivize you to write some short-term with us. As we mentioned, January 1st effective dates are available now. One question we get with this is what happens if I sign my customer up today for a January 1st effective date. They're healthy today, no medical conditions at all. And then 3 months from now, they develop diabetes. And diabetes is a knockout question for our short-term medical plan. What happens then? Well, what would happen is there are 2 pieces to this. There's the eligibility piece, which is the medical questions. When they answered the medical questions, if they were eligible for coverage then, they would be eligible for coverage when it goes effective January 1st. It does not affect their ability to qualify for the plan. However, we do have a 12-month pre-existing conditions exclusion, and that is from the effective date of coverage. So if this person, hypothetical person I'm mentioning, develops diabetes in October, they would have a choice to make. If the doctor says to them, hey, we need you to get you on a regimen with lots of insulin and a lot of follow-up, well, then that person probably would be more comfortable on a marketplace plan because there's no pre-existing condition exclusions there. But if a person was told by their doctor, you know what, we're just going to monitor the diabetes with diet and exercise for the next year. We'll see how it goes. We'll revisit next year when you come back in here. Well, that person might consider taking or keeping the short-term plan because they're not expecting to need their coverage for that for the first year. And because it's only a 12-month pre-existing exclusion starting in the second policy year, anything related to that diabetes would no longer be excluded by pre-ex because the 12-month period would be over by then. So it would be a case-by-case basis when you talk to your customers. So we really do recommend, it's really no different from what we do last year. We've always allowed you to write 3 months in advance starting in October. Instead of a 3-month window, now it's just 6 months. And we're doing this, of course, because of the timing of the executive order. That's the reason it's 6 months instead of 3. So it works the same way, but the likelihood of your customers having a change in health is higher with a larger window. So our recommendation is write the business before the deadline. You can even delay the initial draft for them so they don't double pay. We don't make you pay right away. You can take payment right away, but you have the option to delay it, to synchronize it with their current payments sometime in December. But you should check in with them just to make sure there's been no change in health. Maybe check in with them early December. Like, is everything the same? How you doing? Make sure their credit card didn't expire, things like that, and just ahead of the deadline to make sure they're on the correct plan. And of course, you'll have a lot more time in the fourth quarter to talk up to your ACA clients, supplemental sales, anything senior related if you sell Med Supp or Med Advantage. And we do expect to do a refresh of our fixed indemnity product. We have it available right now in Utah. And this is something we are going to use as an alternative to short-term medical in a post-9/1 universe. So we are going to be launching this in September. You'll see the new plan design. It's going to be more streamlined. Instead of 5 different plan designs, we're going to have 3. Basically, good, better, best. The good or the value level would be designed as a supplemental product to go along with an ACA or a group sale. And then the core plan would be designed to be a standalone product without anything else. And then the max would be a richer version of the core product. When we have more to share on that, we will certainly get it out to you. Just want to show a couple of screenshots here on how can you look for your existing book of business to make sure you don't miss anybody. So if you log into your agent back office, there's the link there on the screen. When you first log in, you'll see a policy tab at the top. And if you click on policies, you're going to see some filter options on the left-hand side where you can go down to one of the pull downs says product category, and you would select short-term medical and then hit search. That will show you all short-term medical policies that you have in your arrangement. And it will populate it in a grid, just like you're seeing on the screen. And the columns at the top are sortable. So if you click on them, you can sort by the most recent to the oldest, back and forth. So you can organize them and say, okay, I want to make sure everybody, did I miss anybody? Just kind of go down and have a conversation. It's an easy way just to sort by termination date to see your book of business and make sure you don't miss anybody. We can help you with that as well if you need assistance. There's one other way you can do it. This is kind of a new feature you may not be aware of. So if you go into our agent back office and then at the top you click on quote and enroll, this is how you get to the actual enrollment page for all of our products. And you'll notice right next to the quote and enroll link at the top, there's a new link called customers. This is not the same customers tab that was on the previous page with the back office. This is a different customers tab. But if you click on that, it'll give you the option to search by customer last name, policy number, phone number, etc. So if you click on that, type somebody's name in, or you can just do a filter search. Over on the left, you can see there's a new filter. Over here, you can say, hey, show me all my STM policies ending in 2024. That would be a good first step just to see everybody who's going to expire before the end of the year. And then you can see they populate in the middle of the screen. You can download that into an Excel spreadsheet, manipulate it that way if you're good with that and you want to do it that way. Or you can find your member and click the open button. And what it will do then is immediately start the quote. It will pre-populate all the census information, the zip code, gender, dates of birth of all the members, and show you the quote screen. So you can start there and get right to it, send them a proposal, or enroll them on the spot.
I would like to add something, Eric, if that's okay.
Yeah, please do.
When you're doing this, just be really careful about the effective date. Right now, it's defaulting to the first of the next month. So it'll be at the top left corner. You'll see the effective date once you open the quote and start a new quote. So just make sure you can change that effective date, like we said, all the way out to January 1st.
Any questions in the box about this, Mary? Or should we?
Nope,
else
not yet.
Okay. We can send you this slide deck. In fact, David, with your permission, I could put the PDF of this into that agent resource page so people can access it. I'll do that for you at the end of this. Sure. Okay. All right, so now I want to go through the short-term medical plan itself to give you some of the highlights, those of you who may not be familiar with it. There is more, we can certainly do a more detailed training on this if you'd like, if you're really unfamiliar with it. We also have those on-demand trainings on YouTube, which will give you the same information. But essentially, we have a PPO short-term medical product in Utah. There are office visits available for everybody. Some have copays, some do not, some plans do not. We waive the plan deductible for urgent care visits. There's a really nice urgent care benefit, which I'll show you. There's a prescription drug option on one of the levels. And we have very flexible coverage periods today, as few as 30 days and as many as 3 full years. And we have next day effective dates available. So you can buy it today, have it effective as soon as tomorrow. And a lot of different plan designs are out there that you can use to toggle to keep the coverage most effective for your customer. The richest plan we offer is the copay enhanced plan. This has 2 deductible options, $6,000 and $8,000 with 100% coinsurance. And they both have $5 million coverage period maximums. So these are $5 million short-term medical policies. There's an option here. There are copays for primary and specialist. These are $40 and $60 respectively. And there is a $10 generic medication copay on the copay enhanced plan. So this would be for somebody that has an expensive generic, perhaps maybe $110, $120 generic medication. If it's on our formulary, they can get it for $10 instead of spending the full $120. So this could be a real cost saver for people with generic medications. And adult immunizations are covered against deductible and coinsurance on that particular plan. The standard plan, or the one that most of us would be selling, is the enhanced PPO. This has a much wider array of deductible options. You can see it starts at $2,500 and goes all the way up to $25,000 with different coinsurance options. The plan we sell the most of by far is that $5,000 100% plan. That's our #1 bestseller. And there are some other coinsurance options in there, 80/20, 50/50, but you can see all of these plans are ultimately $1 million policies. And that would be for the full coverage period that you choose, whether it's 1 year, 2 year, or 3 years. It's the full $1 million for that coverage period. A lot of our agents do solution selling where they will package a supplemental plan like our Plan Enhancer, which is an accident medical expense product, alongside of the short-term medical, with the simple understanding that people that buy this product typically are healthy and don't have any ongoing medical treatment. So if anything's going to happen to them that's going to put them out of pocket a great sum, it's likely going to be an accident or a sickness that puts them in the hospital. And that particular product will cover both of those scenarios. So they might sell, if they buy the 5,100% plan, for example, they might buy a $5,000 Plan Enhancer, so that if they have an accident or a sickness that puts them in the hospital, that's enough to cover that deductible and leave them with zero, virtually zero out of pocket for those charges against their plan. So by moving the co-insurance around, you can save premium on the short term to allow for money to pay for the supplemental plans. Mary and we do this all day long. So if you would like an example of how to do that, we can show you for sure. The lean plan that we have is the Essentials PPO. This is about 20% less premium than our standard plan. There are some indemnity limits on this. We generally don't recommend showing this if you can show the standard plan. But this is available out there. It's what is the coverage period maximum in Utah? It's $1 million here, right?
It's $1 million. It's in every other state it's 250,000. We do have $1 million in Utah on this plan, but there's still limits on outpatient surgery is limited to 15,000. So I'd stay clear of this if you can and go, like Eric said, to the enhanced or copay enhanced.
I think you'll find the premium is sellable. It's we have very, very low rates in the state of Utah, but that is out there if you're interested. All plans have both in and out of network coverage. We have 2 times the in-network deductible for out of network. So you can go in or out of network with our plans. And the family deductible is capped at 3 times the individual. So if you have a large family, once 3 deductibles are met, everybody is met for the rest of the family for that policy year. Office visits are covered on all of our plans. The copay, of course, has the copay plan, the copay options on that. Urgent care, we have unlimited visits for urgent care. This might be the most utilized benefit on the short term. So if you go to urgent care, you go as many times as you want, and all we do is charge a $50 access fee for everything billed as that visit. So if they bill something separately for lab and x-ray, that goes against deductible and coinsurance. But everything that's billed as that visit to the urgent care would be covered for $50. And what we do is we waive the plan's deductible and we apply whatever coinsurance level you chose on the plan. So if you chose 5,100%, this effectively acts like a copay, because if you waive the deductible and it's 100-0 on the coinsurance, the customer pays 0, which means they're only paying 50, which is what a copay is. So it's not technically a copay, but that's how it works out. If you did 80-20, then they would just pay 20% of the charges after after the $50. And it doesn't usually come out to a whole lot more than 50. It could be 70, 75, not a big difference. But you can use that as many times as you want. People love that on short-term medical because most people don't have ongoing medical treatment with a doctor if they're buying STM. Emergency room visits are also unlimited. We charge a $250 access fee unless you're admitted to the hospital. And the cost of that visit goes against the deductible and coinsurance. And of course, any discounts in the network would apply as well before they pay anything. Lab and x-ray, I mentioned, that's all covered against deductible and coinsurance, as are inpatient and outpatient services.
Someone's at the front door.
Well, you better answer it.
Sorry about that.
That's okay. Childhood immunizations are covered first dollar. So there's no out-of-pocket for immunizations for children up to age 18. Adult screenings are also covered. That would be a mammogram or colonoscopy, for example. Those are 2 examples of screenings. They're covered, but they go against the deductible and the coinsurance of the plan. We do apply the discounts before anything, though. So there is coverage for that, subject to deductible coinsurance. And then these are our 2 networks. Utah's a little different. I just
got the question on this.
Yeah. Here's the network option. So we have 2 very, very large, impressive networks, Aetna and Cigna. These are this is the big Cigna, the big Aetna networks. A lot of centers of excellence around the country are included in this network. The rates for these typically vary from market to market. Usually Aetna is a less expensive network, but in Utah, that's a little different. They're about the same, within a few dollars of each other. They're very, very close in price.
Actually, recently, Eric, I've quoted this out, and Cigna's just slightly less.
Yeah,
So,
and Cigna seems to have more of the IHC hospitals locations than Aetna. They both have some IHC, but this Cigna network seems to have more of them. We recommend, by the way, our bonus is only going to bonus Cigna plans too in Utah. So that's another reason. I can't think of a reason to sell Aetna in those situations because pricing's lower, more IHC hospitals. Of course, we know the definition of a great network is the one that includes your customer's doctor. So you have, of course, need to double check all that. But 1 million providers nationwide in the Cigna network, 6,300 hospitals. It's a very, very robust network. You shouldn't have too much trouble.
Yeah, and our quoting platform is currently defaulting to Cigna. So if you find you want to do the Aetna, please watch for that, and you can change it at time of quote.
Yeah. But you're not able to change the network once you submit the case. So please make sure you pick the right network before you submit, or else you'll have to resubmit. And we definitely don't want that to happen after the deadline, because then you'll be out of luck. There'll be no way to change it. Eligibility, we require that that an applicant be at least 60 days old, and they can apply through age 64 years and 10 months. And we allow children to be on the plan through age 25. So once they turn 26, they'd have to be off the plan, but they can stay on their plan until 25. Another point worth mentioning in Utah and most other states too, we allow child-only applications. So you don't have to have a primary or a spouse on the plan with your child. You could have 4 or 5 children on the plan alone without an adult, as long as they're under 18, and we would allow them to stay on that plan. Just make the youngest child listed first, make them the first one you put down. That's our request. It's just easier administratively if there's ever a change. But yeah, there's a lot of flexibility with who can go on the plans. At the time of application, we ask for height and weight, but we only care about weight. So the max weight for a male is 300 pounds. The max weight for a female is 250. And we just take that at the time of application. So anybody, regardless of their height, if they're over 300 or 250 for male or female respectively, they would be ineligible for the short term. Then we also ask a pregnancy question that includes adoption or infertility treatment. We have an AIDS HIV question, and then we ask in the last 12 months if there's anything that's not quite final in the way of a diagnosis or a test. So if your client had a test scheduled and it's not yet been completed for anything other than being preventive, we would require that be completed before they are eligible to buy the plan. So you definitely want to clarify that with a customer. If somebody just took a blood test and they say, oh, I don't know what that is, we need to do more testing. Well, until you do that more testing, you can't buy the short-term plan. So you definitely want to go through that and make sure there's nothing outstanding that they're waiting to get done. And then there's a 5-year look back. This is sort of our big knockout list here. So in the last 5 years, has any applicant received treatment or consulted a healthcare professional, or has medication been prescribed or recommended for any of these? All pretty standard. Just a couple of call outs here on the cancer question, cancer lump, cancer tumor lump or mass. We do not consider basal cell carcinoma to be cancer for the purposes of this application. Basal cell would be allowable, but squamous cell or melanoma would still be knockouts. So skin cancer is that one basal cell is okay. We would still be subject to pre-X. So the 12-month pre-X would still apply, but it's not going to affect eligibility as far as getting the plan. Same thing with kidney disorders. We do not consider kidney stones to be a kidney disorder for the purposes of this application. So pre-X, of course, would still apply to that as well. But everything else is pretty standard on here. Any questions on the medical questions, Mary? Anything through the chat box?
No, just a question about the slides being available.
Oh,
and
yeah.
You mentioned you'll put them on the resource page.
I sure will. We also have preferred rates. So if your customers can answer those medical questions and then a few additional questions, they could save 20% on their premium just by getting the preferred rate. So the additional questions we ask are a coverage question. So if your customer has had insurance 9 of the last 12 months, they would pass. And then we ask a tobacco question. If there's no tobacco in the last 12 months, no DUIs or DWIs, if they have not owned a motorcycle in the last, well, if they don't own a motorcycle currently, and if they've not been treated for high blood pressure, high cholesterol, anxiety, or depression within the last 5 years. This is one you want to verify. So If we find any of these we run a pharmacy check when we submit the application. So if we find that somebody had an anxiety medication prescribed to them in the last 5 years, we would issue a counteroffer. So instead of getting the preferred rate, they'd be offered the standard rate, and they would have the chance to accept that within 5 days. If you have any questions, if that happens to you, please reach out to us. We can walk you through it. In addition to that, we just have a tighter weight chart. So 240 and 190 instead of 300 and 250 respectively for male and female. And then, of course, passing the other underwriting questions. And if they can pass through that, they get an additional 20% savings. So as far as the longer durations, we do have a couple of options. You'll see we have the 12x2 option, which is our consecutive plan option. And then we have our renewable options. In light of the way we've changed compensation and the executive order that's about to go into place, we're recommending most people who really want to keep these coverages as long as possible just to look at the 3-year plans. You can sell it with or without a rate guarantee. And if you don't do the rate guarantee, the rate could change every single year, but they have the option to say yes or no to that depending on their situation. But the runway doesn't do any good behind you. It only does good if it's in front. It's only worth it if it's in front of you. So we really recommend leading with your proposals with a 3-year suggestion if it makes sense for them. And deductible coinsurance resets with each policy term. And it's based on policy year, not calendar year. Here's some limitations and exclusions, all kind of standard. So if somebody's planning to start a family, there's no maternity coverage on a short-term plan. If they need mental behavioral treatment, that's not going to be included on a short-term plan either. So this is really for somebody who is not a candidate for the ACA. And it's important that you confirm which path they should take. This is, again, we're happy to help you make that judgment. If you have a candidate in mind, please let us know. We can help you make that decision, see if they're a good fit for this product. As far as enrollment, we allow you to pick enroll any day of the month. So as soon as the next day, and the initial payment can be taken at the time of application, or it can be delayed any day up to the date before it becomes effective. So if you're doing rewrites, you might want to say, all right, I'm going to have all my rewrites draft on 12/15. So it's the same month that they're used to being drafted. They're not going to double pay. You can pick that date, or you can just take it at the time of application if they're okay with that. It's really your call. And the recurring payments will be between the 1st and the 28th of the month, and will always occur 5 days prior to the monthly anniversary. So if you pick I don't say a 12/15 effective date, it would draft on the 10th of every month. It's 5 days before that, as an example. And we take checking or savings draft, Visa, Master, Discover, and now we take American Express through the portal. So you can do that as well if you'd like the Amex. A lot of people ask for that. And your members have a member portal. There's a lot going on in here, a lot of good features. So claims, there's a claims tab that's being built out. So if somebody has a short-term medical claim or an accident medical expense claim or dental claims, you can find all these things sort of listed in here. There's a whole tab for that. So great follow-up there. They can print their ID cards, print their policy documents. They can update their billing as well. So if something changes, they can go right in there, change their billing without having to call us. Of course, they can if they want to, but this gives them a lot of self-service options. And the website's mobile friendly, so it's easy to use from a phone.
I would try to encourage your members to sign up as soon as they get enrolled. They will get a welcome email, and in that welcome email, they can click on a link that takes them right to the member portal to register with their policy ID. So all they have to do is create a username and password at that time. So it's just a good way to help your clients have a visual to their EOBs, ID cards, and like Eric said, changing payment method. But it's harder to sign up later when they don't have their policy number in hand.
And another, just for HIPAA reasons, privacy reasons, we don't have access, Mary and I don't have any access to claims information, and neither do you as the agent. So it's a really good place to refer your customer if they have claims questions. If they're willing to share EOBs with you, they can do it from the portal. But this is a great way for them to get quick answers. So we definitely recommend calling this out if your clients don't sign up for it on their own.
I want to point out another feature on that, Eric.
Sure.
We didn't talk about the plan enhancer much, but that plan enhancer is one of those products that doesn't have an ID card. So you have to, you have your members submit a claim. And they, of course, they can do a paper claim, which is very tedious. So if they go to the member portal and they go to their plan enhancer tab, it says start a claim. And they can upload their EOBs and everything that we need. And it's a really much quicker, smoother way to submit a claim to us for those accident plans.
Yeah, we recommend using electronic claim filing if possible, definitely. So here are the details on the bonus plan here. It's a short-term plus an ancillary bonus. It started in May. It's going through the end of August. And we have a minimum requirement. So if you write a minimum of 15 short-term medical plans, you will receive bonus money on each of those 15 that got you there. And we're only bonusing 2- and 3-year plans. So if you write a 12-month plan, 6-month plan, 2-month plan, those won't count toward the bonus. But they must be submitted and signed by 8/31. That's the deadline to count for the bonus. And we are paying $50 per supplemental bonus when it's attached to a short-term sale. So it has to be in the same shopping cart at the same time. So if your customer wanted a $5,000 100% short-term medical plan, Cigna Network, with a $5,000 plan enhancer with a value dental plan, they would get, if they got a 3-year plan, they would get $500. Once they get to the 15 minimum, they get $500 for the short term, and then another $100 for $50 for each supplement. So they get $600 for that shopping cart. And there's no maximum. The only caveats are the $15 minimum on the price of the supplemental plan. And the plans have to be enforced for at least 4 months or we could claw it back. So obviously, if you're delaying payment, you won't know until 4 months after January 1st. But that is a caveat out there. And again, I just want to call out one more time. The Cigna Network is the only network on the short term that we are paying bonuses on in Utah and 3 other states listed on the screen. So Utah, definitely go Cigna. There's a lot of reasons to do it there, even without the bonus. But that particular network performs better for us. So that's why our finance people are limiting it to Cigna.
And it's a great network nationally anyway. So you're going with the biggest of the 2 networks. So if people travel, they still have a great network everywhere else.
Definitely. And all this again, they're going to be on the they're going to be on your client your Stonehill agent portal shortly here. Couple more pieces here. We have a new alliance. I trust a lot of you are familiar with Health Sherpa and use that perhaps for your ACA sales. Well, we believe this is going to happen. It is technically subject to CMS approval, but we have an arrangement with Health Sherpa where you can sell our supplemental plans, our accident plans, dental plans, cancer plans, alongside of your ACA sale through Health Sherpa. You can access it through our portal or through your own. We don't have any screenshots to share yet, but this is an initiative that will be available before open enrollment. And we'll certainly let you know once we have more to share on that. But this is something we're really excited about. It's a lot easier and faster to use one enrollment platform to sell your supplemental policies alongside your core medical than to do it twice, than to take them to 2 separate portals. The clients lose patience and you have too many people to talk to. So this is a really nice arrangement that we're excited to announce to you. We'll have more to share soon here. But we have a bunch of products that are guaranteed issue, specifically our plan enhancer, that accident medical expense plan we were talking about. You can sell it with or without rider options in Utah. The 2 riders are sickness hospitalization and cancer, heart attack, stroke. The sickness hospitalization rider pays the same benefit you sell for the accident, which again can go from $2,500 all the way to $17,500. It's a big range. Whatever riders you add match the same amount that you choose for the accident, and it's completely guaranteed issue, so you don't have to worry about clients qualifying for it. There is a 12-month pre-ex on the sickness hospitalization piece, which I'm sure you can understand why we do that, but there are no medical questions. And if you sell it accident only, you can sell it for your seniors. So if you're in the senior space, you can sell up through age 70 right now, a plan enhancer without any of the riders, just the accident piece. And the rates on these are the same for seniors as they are for those under 65. And the pricing is just single and family. So if you have one person, it's one rate. If you have 2 or more people, it's the same rate. So this is especially important in Utah for your big families If you have 7 children and mom and dad and 9 total people, it's the same rate as though as if you just put mom and dad on the plan. So it's a really well-priced product already and very, very beneficial to large families. And it does not coordinate benefits. So that can mean if your out-of-pocket is satisfied already for your major medical for that year, and you still have $5,000 worth of accident charges, we're still going to pay for those and send them right to the member. So the money goes to the member, not to the provider's office, and they can do with it as they please. It's a really flexible product, really quick to file a claim through the member portal, like Mary was saying, really the perfect gap product for your ACA clients. So we hope you'll take advantage of that. And then a hospital expense protection product we also have. This one does have some medical questions, but it's got a $25,000 air ambulance benefit on all levels, and the plans start at $11 a month. So really low cost, a lot of hospital benefits that you can use to pay in addition to whatever your major medical plan may or may not cover. It's just extra money to help cover deductibles. And there are some discounts for bundling.
Excellent.
And then just a quick overview of our dental portfolio here. We have our select dental PPO. We've got the traditional co-insurance plans here, which have no waiting periods and have up to $3,000 of annual maximum. 3 different levels, and orthodontia is available on the richest plan, on the top level prime plan through age 19. And if you sell this alongside anything else, we give you a 15% dental discount. We've also got our copay 2 dental, which has no waiting period and has no maximum. So if somebody bought it today, they could get a root canal tomorrow and pay $500 for that root canal as long as they stay in the network. Really, really rich plan. Our best selling dental plan by far right now. But again, we ask you make sure that they stay in the network. The network, by the way, is the Aetna Dental Administrators Network for this plan. Please reach out to us. We can give you more details on that. We've also got a cancer, heart, stroke standalone product, which is the same version that we have on the Plan Enhancer, but with a higher face amount. So you can sell that up to $75,000. A lot of options, a lot of things you can offer your clients to gap exposures. And that's what Mary and I are here for. So please reach out to us. We can give you all the details and help you make those determinations. How's the chat box, Mary?
We're good.
Good.
All right, let me go to the end here. Oh, hang on. Let me just go back to this front screen here so you can see the agent resources page. Hang on a second. Okay. Any other questions before we part here? We kept it pretty close to 45 here. Hopefully that's good for you, David.
No, I appreciate it. Thank you.
Mm-hmm.
One other point, maybe some of you don't think you can get to the 15 apps. We are going to do another promotion with this Elevate Rewards for those of you who can't get to that. So make sure to sign up and watch your email for a little rewards program that we're going to put out in the next month.
Excellent. Doesn't look like there's any other questions here. So again, always great working with Eric and Mary there. We love working with Allstate there. So even with the changes to the regulations, and who knows how those may change in the future too, but at least for right now, it does create some good opportunities. So if you need any assistance, accessing your book of business or seeing your clients, make sure to reach out to any of us, Savannah, myself, Mary, and Eric, and we can go ahead and get those put together there. So you have some contacts you can make through the month of August there. So we have a little bit of time here, and hope you can take advantage of it. So. Again,
one other thing, David, this
yeah.
August 31st deadline, that's
Yes.
by the way, the Saturday of Labor Day weekend.
Oh, of course. Yes. Yeah.
Yeah. So,
Okay. So take that into account. Yeah.
Yeah.
As you're planning your,
Reach out early.
outreach. So there you go. Always good to know that. So I appreciate it, Eric.
Thank
Mary.
you, everybody. Thanks, David. Thanks, Savannah.
Talk to you later. Thanks. Bye-bye.
Thank you.
Thanks.
Bye-bye.